Thank you, Steve and Camille. It's really a pleasure to speak at this conference. The morning talks were tremendous, and I hope I can live up to the expectation that those earlier talks garnered. So today I'm talking about a rather serious public health problem that we've been struggling with in the United States and are beginning to grapple with internationally as well, and that's the obesity epidemic. And one of the ways in which we're trying to explore the obesity problem is by trying to understand upstream determinants of people's behaviors. It's very hard to just ask people to eat healthier, live more active lifestyles. Easy for doctors and family members to suggest to you, very hard for us to actually follow and make those changes. As someone who's involved in environmental health, I think about ways in which we could change the environments in which we live to help make those decisions a little bit easier. Part of the research that I do is to actually understand the environments that are more conducive to active living, better diets, and so forth and so on. So I'll show how we're using data and visualizing in different ways for obesity. And this is really the tip of the iceberg here. So, you know, there's a number of statistics, very scary statistics that are bantered about within the obesity public health world. You know, statistics for the United States are quite impressively depressing. More than a third of adults are obese in this country. If you look at children, about 17% of children in the United States are obese. And why is obesity important? Well, obesity is one of those things where it isn't that important of a health outcome in itself, but it's kind of on the pathway to a number of different chronic disease endpoints. Things like having a heart attack, having a stroke, being at risk for type 2 diabetes, and it's a risk factor for a number of different cancers as well. So if you think of obesity as something that public health people could target for prevention, it's very, very important for us. And then obviously, you know, with something that is upstream to a number of different health outcomes, there's tremendous health costs or avoidable health costs associated with dealing with obesity. So in terms of data visualization, this is, you know, one of the visualizations that CDC puts out, which sort of illustrates the trends in obesity patterns that we've seen over the last couple decades. As individual snapshots, they're not that impressive, but when animated, you begin to see the sort of trouble that we're in this country. And so this is, you know, the prevalence of obesity across states in the United States. And you could see, sort of as this sort of scrolls through the years, that things aren't getting better, but rather this map is getting darker and darker red over time. And so, you know, as a country and as public health researchers, we've been trying to understand what it is about our lifestyles and the environments in which we live. And they could either be social environments or food environments or built environments, you name it, that could be responsible for this. There are other types of visualizations which are a bit more dynamic. And this is one that I found from the Robert Wood Johnson Foundation, where they talk about this trend. And what's interesting about this is there's a slider that talks about sort of our avoidable future. And so this is the map where this is business as usual, a rather dark map where there's a number of states where more than half of the population of adults are obese, to a somewhat brighter future in which for each state they reduce their BMI levels by 5%. And what's interesting about this visualization is that it's data-driven. So they've gone through, and they have a report that goes along with this infographic, that talks about the avoidable healthcare costs that are associated with just a 5% reduction in BMI. And so if you think about sort of dynamic visualizations, ways to explore data, this is an example of such a visualization. Another really interesting visualization in terms of research, I mentioned that, obesity is a very complex thing. At its core is this sort of thing where, energy balance. What's hard about understanding obesity? It's people exercise, people eat. That's energy balance. But as this little snapshot with all these spaghetti arrows illustrates, there's a lot more to actually understanding the metabolism and the physiology of people that sort of drives energy balance. And what's nice about this infographic is, as a researcher, I can go in and I can actually study some of the hypothesized mechanisms that are related to diet, that are related to physical activity. And all of these things would be interesting, if not impossible, to look at in epidemiologic studies and whatnot. And, this is sort of the current snapshot of our state of knowledge today. But as research grows, there could be other risk factors that we continue to add to these types of diagrams. So another sort of interesting thing in terms of data visualization that may be affecting behaviors is food labeling. And there's a lot of innovation that's happening with respect to trying to alter people's understanding about the caloric consumption patterns that they're experiencing. This is sort of the everyday food label that you see today. This is already an updated, a newer form of nutrition labeling. Fairly recently, this is a New York Times article where they talked about what might be an easier food label to try and understand. And this is an op-ed piece out of the New York Times where they talk about a more holistic way of considering food. And here you can see, nutrition is just sort of one axis on this graph here. But there's also foodness and welfare where social impacts are also considered. And so if you click through on this link, you can see that, things like welfare are related to, things like, was the agriculture produced in a socially responsible way, free trade and all that sort of stuff. So, those are things that are happening in the United States. And so, very sort of minute and detailed things where people can think about, what's a better food label that you could stick on a packaged good. But what we're beginning to understand is that internationally, the obesity epidemic is also taking hold. And perhaps it's becoming more of an important issue internationally because there's less capacity to think about these more nuanced, what's a better food label, that sort of thing. And so these are some statistics. It turns out that now, 65% of the world's population lives in countries where being overweight actually causes more morbidity and mortality than being underweight. And so that's rather striking if you think about all the poor countries that are out there. And in my own research, I've been looking at changes in the food environments that are occurring in China. And so this is the sort of example that I'm seeing in my research, where you see these kind of environments of old where there's a lot of food diversity, a lot of fresh fruits and vegetables being sold, very low wait times from the field and into people's homes. They're not packaged, so no cellophane, no plastics, no nothing, no preservatives, to transitions to these kind of environments where there's a tremendous amount of packaged goods being sold. And these types of environments are much more accessible within neighborhoods. They're community stores. They're on every single block. And I dare you to find a single unwrapped, unpackaged, unsugar-added piece of food in this market. The other thing that we're seeing is the westernization of diets. Again, this is a photo not of Berkeley, but rather of Western China. And you could see not just a Western McDonald's in this photo, but rather a drive-through Westernized McDonald's. And this is in China. Similarly, food advertising is quite rampant. So not only do you see the Westernization of sugar-sweetened beverages, but this is just your average mom-and-pop Chinese restaurant in China. And I don't know why, but suddenly I feel thirsty for a Coke. So what have we been doing in terms of collecting our own data to explore some of the changes that are occurring in China? Well, we've been using smartphone technologies, and smartphones are fairly pervasive technologies even within China. And so it provides an opportunity to track people's behaviors. And so how are we doing that? Well, smartphones have lots of sensors, and sensors provide a lot of real-time data. In particular, we've been using the GPS, and so we can use GPS to track where people are going. We could turn on the accelerometers so that we could understand physical activity patterns. And this is some lab validations that we did looking at the accelerometry data against smartphone accelerometry data with some metabolic carts in the laboratory. This is what a GPS trace looks like for me in China as an example. And what's interesting about this is you can see some point clusters where I spend time. And spending time is important because I could see at what time those points cluster. And maybe those are places where I spend time and eat. And so we could actually use some algorithms to identify these stay points. We could map them out onto other data sets like the road networks so that we can try and understand where I spend time, where I have energy expenditure. And in particular, one of the tools that we've been developing is a data mashup where this is actually Google Map data where I issue Google Map queries to try and pick out different types of food environments, everything from restaurants to corner convenience stores to fast food restaurants and so forth. And I can overlay those GPS patterns and those places where I spend time on top of these food environment maps to understand what is it about particular neighborhoods and their food environments that affects my diet. And so this is a live website. It's in beta, and it's a little bit embarrassing to present this compared to the rather fantastic data visualizations that were presented this morning. But it's interesting that we're using this website both for research, but once we figured out how to grab the data from Google, we decided to create a portal that's public-facing so that food policy researchers, whether it's domestic food policy researchers or international food policy researchers, can go on and do queries of their community and see how they're changing over time. You could sort of get a hint down below that we produce tables of data so that if people want the list kind of format to do analytics on, they could download the data off of our website and do more analytics off of it. So that's sort of what we're working on in a nutshell. It's very much work in progress. So if any of you have any comments or suggestions, that would be wonderful. Thank you.